Let's talk about medicating a cat. A wise man once said that he is only afraid of two things in life. One is dying, and the second is to try and peel a cat. That wise man is actually me, unless someone else thought about this joke before I did. But what can you do in order to make life a bit easier for you and your cat? I'm Dr. Orion, a veterinarian and a veterinary behavior specialist. And that means that many times I will tell the owners to give some medications to their cat when they're sick, when they're unhealthy, maybe to calm them down a little bit, depending on the situation. And the most common kind of medication that owners will give their cat is the oral form, and usually pills. Now, just before we continue, you really need to understand that because of my accent, when I'm saying the word peel, I'm actually meaning, to give a pill to a cat. I don't mean to peel a banana, although you might try to peel a banana.
Come on, it's just one little pill. It will make you feel so much better.
But don't try to peel a cat. Peel? You know what I mean. Yes, it's hard. The first thing you want to try is to actually take that medication and hide it inside of something that tastes really good. Many cats will be fine with it. So, for example, using something like churro, which is a sort of a very tasty paste that cats like, or even hiding it in high-value canned food, for example, Hill's AD, and they're not paying me anything, is very, very rich, so the cat will like the taste of it very, very much. You can use that canned food to form 3 little meatballs and basically hide the medication in one of them. Now you give the first one that doesn't have anything inside, then you give the second one that has the medication inside, and then really fast you give the third one that also doesn't have a medication inside. By doing that, we're trying to not create an association between the tasty canned food and the medications that's inside. And then it might work for the long run. If that doesn't work, then why not try something like pill pockets? Now, there are different companies that make them, and there are different flavors. So if one of them doesn't seem to be very effective, try another one. And I would say, kind of like with the meatball system, try to first give one that doesn't have anything inside before you give the one with the medication. Some tablets can be smashed down and then the powder can be hidden inside of some sort of wet food or anything like that. But sometimes you can do it, especially if it tastes really bitter, and a lot of the medications do taste pretty bad. Same goes for capsules. You can open them up if it's safe to do so. Sometimes it's not. Sometimes if you break a tablet or if you open a capsule, then the medication might not actually work like it's supposed to. But in the cases that it is an option, then you can try and hide that inside of something that tastes good, or sometimes even dilute it with a little bit of water inside of a syringe and then squirt it into your cat's mouth. If the cat is really resisting, then don't try to do something like that, because we don't want the cat to accidentally aspirate the medication, meaning that he's breathing in the water with the medication and getting pneumonia or other issues. And if we're already talking about different forms of medications, then the next thing you can do is actually try something like a liquid medication. In many cases, when it comes to cat, you will have an alternative in a form of a syrup or some other liquid formulation. Some veterinary pharmacies can actually compound those antibiotics or other medications into a liquid form that has a flavor to it. It can taste like chicken or beef or fish, and you can choose. Generally speaking, I actually don't recommend using the liquids on the food itself, just because you don't know if the cat actually ended up eating that entire amount of the medication when he was eating the food. Some medications, not all, come as an injectable form. For example, Convenia, which is a type of an antibiotic that stays in the system for 24 hours. It's a broad spectrum antibiotic, so it actually covers a lot of things, but it might not be the right type of medication or the right type of antibiotic for every condition that requires antibiotics. So it really depends on the case. It is usually more expensive than oral medications, but then you don't actually need to fight your cat over medicating them, and you're not going to lose money on a medication that you might not be able to use to begin with. Of course, like any other medication, it can have side effects, so always make sure with your veterinarian that you're aware of what the cons are. Another long-acting medication that sometimes can be used, even though I will say that I rarely use it anymore, are steroids. There is a type of steroids that can be injected once every few weeks and stays in the system. Problem is that the side effects of steroids can be really, really severe. They can even cause diabetes. So if it's already in the system and it's going to stay there for at least a few weeks, that's going to be a problem. Having said that, there's some situations that if there's no way to treat the cat and the cat is going to die without any treatment, maybe then it is worth taking the risk. But again, have this discussion with your veterinarian. The last form of medication that you can use is the transdermal version of some medications. Dermis is the skin, so the transdermal medications are medications that are absorbed through the skin. And I'm pointing at my ear not because it's itchy, but because you usually will apply a thin layer on the inside of the ear pinna. The pinna is the external part of the cat's ear, so we don't actually put it inside of the ear canal, we put it on the skin of that triangle ear. Usually it comes in a type of a syringe that you turn something, you click something, and according to the number of clicks, you get a specific amount of medication. So when you're prescribed that medication, it will tell you how many clicks you're supposed to use in order to get the right amount of treatment. Now, a lot of medications can be actually made to be an ointment version, a transdermal ointment version. But a lot of them, even if you do make them at that version, they're probably not going to work because there's a bioavailability that sometimes requires the medication to actually be ingested. Other medications work like a charm. For example, thyroid medications can be absorbed through the skin of the ear. And there's a medication called Mirataz that we will sometimes use to increase the cat's appetite. The most common side effect of those medications would be irritation on the site where you're applying it. Now, a few other things you should consider. One, if your cat is healthy now, why not work on reward-based training to get your cat to like different types of interactions, including those that are kind of like putting treats in the cat's mouth. Try to get your cat to accept having you put something down their mouth that is maybe shaped like a medication, but actually tastes really good. And use that as well so they know that not every time that you're putting your hand on their face, it means something bad is going to happen. And of course, the environment. Try to create the most pleasant environment possible with some calm music in the background. Maybe use something like a feel-away diffuser, anything you can think of that you know your cat likes. Now, don't forget that your cat is feeling sick. That's why he's getting the medication to begin with. So don't get mad. Try to do your best. And if it's not working, speak to your vet about alternatives. And yes, worst case, sometimes we will have to hospitalize those cats, even for things that are relatively simple, because if the owner can't medicate the cat, then we might want to give those medications through an IV catheter, and for that we need the cat to be hospitalized. And yes, it might start from a very little thing, but it might progress into something very, very severe. And that's why you should consider hospitalization as well. Of course, it's going to be more expensive and sadly more stressful to the cat. Always weigh the pros and the cons. If you like this video and you learned something, or if you like the AI version of a veterinarian peeling a banana, then please like and subscribe. And in the meanwhile, why not watch this video next?